Hello, now hope we are okay. We are fine. We did the introduction to counseling, and we looked at what counseling is, the definition, the difference between psycho and social, basic features, counseling theory, counseling interventions, and counseling relationship. And we also discussed on the qualities of a good counselor. Today, we're going to look at counseling process structure. Counseling process structure. Okay, so what do they mean when they say counseling process structure? A counseling session takes not less than 45 minutes up to 1 hour. It takes place in a session depending on the client's needs and the counselor's personal approach to counseling. Okay, every counseling session takes 45 minutes to 1 hour. That depends on the problem that you, a counselor, is solving at that particular time, or the problem that you are looking at that particular time. So it depends on what kind of problem that you are discussing with your client. So the session can go up to 45 minutes to 1 hour. Okay, so although there is some duration during a session, there is a basic structure, a 5-stage process. Although there is some variation during a session, there is a basic structure, a 5 process. Okay, the strength of the working alliance depends on the degree of agreement relating to the goals and tasks of counseling and the level of emotional attachment between you and your counselor. So the working alliance for every counseling session depends on the emotional attachment, how you relate with your client. Okay, you as a counselor and your client, how you relate, the relationship that you create between the two of you. Okay, that strengthens the counseling session. Now, the first 5-stage process that we're going to look at is establishing the relationship. The first one is establishing the relationship. Tasks that include: 1, laying foundation for trust. You need to lay foundation for trust when you are creating a better environment with your client. So you lay a foundation of trust with your client. It's very important for you as a counselor to lay trust in your clients, or your client, they should have trust in you as a counselor. That is because you as a counselor are being genuine, honest on those qualities of a good counselor that we looked at. Okay, establishing the structure and form for the relationship will take: 1, informed consent. A client should first be given sufficient information and should be helped to reach an adequate understanding of what is involved in the counseling. So it's important for you to tell your client what is really involved in counseling, the services that you offer. Okay, talk about confidentiality, talk about the privacy that you maintain, your competence, and how you respect your clients. When you do that, you are creating a good relationship between you and your client. You are building your relationship. Okay, so now, articulating roles of a counselor and client, developing a collaborative working alliance. Articulating roles of counselor and client, developing a collaborative working alliance. You need to develop a collaborative working alliance between you and your client so that the problem at hand can be worked on. The problem at hand can be worked on and finding a solution, or your client making a better decision to their problems, which is very important. Okay, still on establishing the relationship. The room should be a quiet place that has doors and that close and where there will be no interruption. So I talked of privacy last time, that as a counselor you need to maintain privacy. You need to make sure that the privacy is maintained in your counseling session, where your counseling room should be very much far away from the outpatient department, OPD, where there is no noise, there is no interruption with other workmates. Just have to be you and your client at that particular time. So the first thing that you do when you're establishing the relationship, you have to introduce yourself, your name, and explain the law that you are praying in that facility. Talk about the 45 minutes of your session so that your client is very much aware of how long the session is going to take. All right. So it's very much important for you to introduce yourself before your clients, and also make sure that you explain the law that you are praying in that counseling session. Okay, ask the client to introduce themselves before you. It's very important to know the details of your clients. You ask them to introduce themselves. You are creating, or you are establishing the relationship between you and your client. Explain what is discussed will be kept confidential. You need to explain to your client that whatever you discuss in that counseling session is going to be kept confidential and privacy is going to be maintained. So it's very important to discuss those measures to your clients. Ways to begin a counseling session. Okay, talk about ways to begin a counseling session. Can you tell me why you came here today? You are asking your client, you are starting your counseling session. For example, you know the name, may I know you? The client will explain the name, where they're from, what they have come here for. Then you ask, how may I help you? Or can you tell me why you came here today? Okay, where would you like to start from? You talk about where you want to start from, it be it where it started from, or just maybe at that particular time when the problem occurred. Okay, core conditions necessary for successful counseling and purpose surveyed or saved. Empathy promotes rapport and relationship. Empath promotes rapport and relationship. There is that trust that is built. There is that relationship that is built between you and your counselor once you promote empathy. Empathy, like I said, is being in your client's shoes, taking the client's problem into your own hands. That is empathy. Okay, unconditional positive regard. Client as a person of where they separate from actions. Congruence, genuine self in a client interaction. You need to give respect, which is strength for focusing. Respect is the strength for focus. Once you respect your client, you have the strength of focusing in your counseling session, which is very important. Second, establishment of the counseling process. Second counseling process that we're going to look under the 5 stage processes. The second one is understanding the problem. Let the client talk about the thoughts, feelings, and actions around him or her, the issues that are affecting your client. You let them talk about those problems. Let them narrate the story to you for you to understand where to start from in your counseling session, or how to start your counseling session. So you let them talk, you let them bring out their feelings, their thoughts, and actions to their problems, so that you are able to detect or to dig deeper and find where the root cause of that problem came from. Okay, use the essential counseling skills. So it's very important that whenever your client brings a problem, you apply the counseling skills that we're going to talk about in the next topics, okay, when we'll be dealing with counseling skills. So you let your client talk, narrate the story. As you start dealing with the story, as you start dealing with that problem, apply the counseling skills that you are supposed to apply. Help the client decide which issue or problems are the most important to talk about during the session. You need to help your client decide which issues or problems are the most important to talk about during the counseling session, which is very important. Still on the understanding the problem, tasks of this stage. There are some tasks that we talk about under this stage of understanding the problem. The first one, or the first point, is gathering information, psychosocial, which is interview. So you apply psychosocial now, you dig deeper, trying to know the information. Remember, psychosocial, it's something that comes from the mind. Okay, problems occur from the mind, and then we ought to deal them psychologically through interaction, which is social. Social is all about socialization. It's from sociology, the interaction that you have between you, a client, your counselor, and your client. Completion of risk assessment where appropriate, where you need to apply now observation. Okay, you assess, you observe every movement where your client is communicating, the eye contact, the behavior, the non-verbals, all those languages, you have to observe them. Identifying the nature of presenting presenting problem. What kind of change is sought? Counselors' role in helping the client to articulate and solve their own problem. Diagnosis. We do not diagnose using any machine. We diagnose using psychology. Okay? Through communication, how your client is communicating, we are able to diagnose the problem where it's coming from. Okay, the mind, when the mind is disturbed, when the mind is not stable, there's something that is eating your client up. You are able to tell. At times, like I said last time, you find that a client will come in the presence of maybe STIs, then they would write to say, okay, I have a chest problem. Now you see the movement, the body language also speaks to you that your client at that particular time is not really communicating what is on the problem that they are facing, but there's something else that is happening. So you ought to tell your client, are you really comfortable the way you're seated? Because the body movement also speaks, the eyes also speaks. Okay, so when you are looking at your client, it's very much important to maintain the eye contact when you're communicating to your client, for you to find out the real problem, for you to diagnose the real problem that your client is going through. Formal diagnostic assessment. There's under the same process of understanding the problem, there's what is known as formal diagnostic assessment. Formal diagnostic assessment or interview format, there's what we call focus. Basic screening questions. So you need to look for basic screening questions. Detailed inquiry. So how do we find this, or how do we do the focus on this stage? Presenting problem and context. Basic questions. What concerns brought you here? So those are basic questions that we are looking at. Basic questions. What concerns brought you here? Why now? Has this happened before? How is it an impact in your daily life? Those are basic questions that we ask our client. Detailed inquiry. Clarify stressors. Ericity. Ericity will simply mean getting info or reaction. Coping skills, social support, and resources. Coping skills, social support, and resources. Clarify the function. Work, family, health, intimacy. So the client at that particular time, the client is supposed to explain how they feel about how they cope with the problem when they are in this stages. Maybe when they're at work, when they're with family, when their health status, intimacy, how is this problem affecting them? So they have to explain how has it been an impact to your relationship. How has this problem been in your relationship or in your family? Any effects? Talk about that, and then your client will be able to explain. Other basic questions that you can ask: how do you feel now? Okay, how do you feel now? How has your mood affected? How have you had any unusual experience? How is your memory? Do you think that life isn't worthy living? Those are questions that you ask, especially for those maybe who wants to do suicide. The detailed inquiry of this stage: not age of mannerism, degrees of grooming, orientation, beliefs and feelings, because the people, they have got beliefs, they have got feelings, how they take feelings. And defining feelings, we'll look at, there's a certain topic: feelings, they are natural, normal, that's how they are. They are not bad, they're not good, they're just natural and normal. People have got different beliefs from different cultures, from different religions, different beliefs, personal beliefs, family beliefs, community beliefs. You need to probe anxiety symptoms, find them, form content, thoughts, appearance, attitude, behavior, suicidal ideation, variation impulses. All those, we look at them, which is very important. Number 3 that we're going to talk about on the counseling process and the stages are supporting decision making or goal setting. Always, as a counselor, support the client to make their right decisions as their next step. It's very important to support your client to make right decisions as their next step to every problem. Help client explore the options, but it is ultimately the client's decision to make. You help them explore on the options. Let your client make decision. It's up to them to make the decision. We counselors don't make decision for our clients. Number 4, interventions and problem solving. I think I talked about crisis intervention, the other intervention, counseling interventions. Objective: initiate and facilitate client change. It's very much important for you to initiate and facilitate some client change in them. The behavior change, they need to change their behavior, their thought, way of thinking, everything about them which is affecting their life. It's very important to talk about it so that they change. Begins as soon as goals are established. This is planned for how to achieve them. Answers and questions: how shall we accomplish this goal? Action direct in record with new perspectives, talked about but lived. Collaborative establishment plan works best. Educational, in that client is offered information regarding options and advantages. Also talk about disadvantages of that problem for each problem that your client brings about. It's very important to talk about advantages and disadvantages. To solutions, you also talk about advantages and disadvantages. If they are there, you talk about it. That is how a problem is solved. Number 5, ending the session. Summarize what was discussed during the session. It's very important for you to summarize whatever you have discussed. That is now we talk about when you'll be looking at counseling skills: paraphrasing, rephrasing. Very important. Information giving. It's very important for you to summarize your counseling session so that your client, you find out if your client has not missed out any information. So summarize your counseling session. Ask questions. Anything where you're behind, feel free to express yourself. Review the client's next steps. Give the client a chance to ask questions. It's very important. Let them ask questions. Let them have that chance. You are promoting autonomy. You are promoting autonomy to your clients. Make referrals if you need it. If there is any referral, example, if you are talking about HIV and AIDS, then you find that maybe that person you tested, the person is reactive. If you are making referrals, it's very important to do some referral. You refer the client to your doctor or any clinician or the nursing officer in charge of the clinic. You refer your client for further investigations. Discuss when the client will return and make sure she or he has an appointment. So there is always some important process of making an appointment with your client. If there is any need for them to come back, like example I can give, when we are talking about HIV, we test somebody, we find that they are non-reactive or they are negative. We will tell them to come back after 3 months. That's an appointment. So after 3 months, you expect your client to come back. So it's very much important to discuss about when your client should come back. Now, steps in problem solving and examples of what you can say as a counselor. Understanding the client's problem. 1. Help your client define the problem. What would you like to discuss today? What would you see as the main problem to this situation that you've brought? How are things different from the way you want them to be? What are the changes you are facing? That's the first one. The second one, help your client analyze the problem. It's very important to help your client analyze the problem. Let them think through. It's important for them to retreat to their problem. How does this problem affect you? That's the first question when you are helping them to analyze. How does this problem affect you? How does it affect other people? How do you manage now? What do you think are the causes of the problem? You talk about that. You're understanding the client's problem. Support the client with decision making. You need to support your client with decision making. Help your client set goals. Very important to set goals in life. Even you as a counselor, you can set goals of your own. Counseling, we practice what we do in our daily life, what we see and what we hear. So how do we help our client set goals? What do you want to see happen? You ask your client. What is your goal related to solving this problem? You ask them their goal, the related goal in solving their problems. Number 4, you help client come up with solutions. What do you think are some solutions to this problem? What do you think are the next steps that you could take to your problem? How do you manage the similar situations in the past? How have other people you know managed similar situations in the past? Do you think the solutions are realistic for you? What do you think some of the challenges will be to this problem? What do you think some of the consequences will be to this problem? So this is how you help your client come up with better possible solutions to their problems. Then you summarize the session after that. We have talked about a lot today, but we have identified your main problem as being you talk about the problem. You have spoken about some ways that you can address the problem. Some of the solutions we have talked about that is a summary of the counseling session. You suggested that you would try to do this as in the next step. Those were ways spoken by your client. I will check in with you at your next appointment to see how things are going. You can always come back and talk to us anytime. Supporting your clients in finding possible solution. Okay? Now, counseling step by step. Counseling step by step. Now, let us see how we can go about the counseling process step by step. The first one, when you are following the counseling steps, the first one is preparing for counseling. You as a counselor, you need to prepare yourself for counseling. Prepare yourself for counseling. Ensure that the counseling room is neat and comfortable. Okay? Ensure that the counseling room is neat and comfortable. Pay attention to the furniture, lighting, and privacy. So you as a counselor, when you reach your counseling room, ensure that you do the dusting, clean the room, open the windows, see that there's soapy water, the bins are not filled. Ensure that all the desks are in the arrangement, everything. You prepare your counseling room so that it gives free ventilation, it gives your client that motivation as they enter. Okay, be on time. Always keep time. If the counseling session is supposed to start at 8 hours, ensure that you are there before 8 hours. At least by 7 you've reached, you do the dusting. By the time it is 8 hours, you start your counseling session. Okay? Have a system to record information about the client. Name, sex, address, phone number, email address, date of birth, marital status, occupation, etc. This gives a bit of background and makes it easy for you to contact the client. So it's important to keep these records. You keep record of everything that you discuss with your client, know their address, know where they come from, their phone number. So if there is any problem, you can trace them. Okay? Background, everything about your client that you need to know, ensure that you record. The second one is establishing a relationship, joining skill. We'll talk about the joining skill. Establishing a relationship, you join. So you warmly welcome your client and offer a seat. Very important, please take your seat. Take your seat. Pointing at the chair. Welcome them in a more friendly manner. When they knock. What do? As a counselor, because you are putting that courtesy, you want your client to feel welcome. You stand, you greet them. How are you? You are welcome. Kindly take a seat, as pointing the chair. You shake hands. When they sit down, you ask them, may I know you? They will explain, they will tell you their names and everything. You don't need to start recording on a piece of paper. It's not very much important. It doesn't make your client comfortable. Okay, they are sensitive people. Introduce yourself and allow the client to do the same. Agree on the language that you're going to use. It's very much important to ask the language that you're supposed to use. Okay? Very much important. If they don't understand English, tabomfa ichisungu. Kuti mwabomfa ichibemba, Tonga, Lozi, Luvale, Kaonde, any language that your client is comfortable with. That's the language that you use. Initiate a belief social talk. Ask how the client is. Chat about the weather. Ask the family, etc. Getting to know your client. You are initiating your client to be in a conversation or to talk about the problem that has brought them to your service. Step number 3. Conducting a counseling session. Discuss the reason for the visit. Something like, so what brings you here today? You ask your client, what brings them to your service? Master the art of asking open-ended questions during the sessions. So we have, is it 2 types here? I think we have 2 types of questions that most people ask. We have open-ended questions and closed-ended questions. But in this form of counseling, it's very much important for you to ask open-ended questions rather than using closed-ended questions, because when you are using closed-ended questions, you lock yourself as a counselor. Instead of you talking less, you talk much because you are using closed-ended questions. But when you use open-ended questions, you find that your client speaks more than you speak. Okay? So It's very much important to practice or to master open-ended questions during the counseling session. Affirm the client and put him or her at ease by saying, I would like to congratulate you for deciding to come so that we could work on your situation. Share your confidentiality rules with one. I assure you that our counseling relationship would be very confidential. I would not share anything you tell me unless it involves hurting yourself or another, or if the information you give is required by the law for me to reveal. That is confidentiality. You are assuring so that your client can talk more. So agree on how long the session will last. Inform the client of what he or she could expect from you. Role including the right to refer. Listen to the problem carefully before coming to any conclusion. It's very much important for a counselor to listen to the problem before you come to any conclusion. Show a deep interest in what the client is saying and ask questions for clarification. Try to identify the problem. 3 basic questions in counseling are the following. What is going on? How do you feel about it? Do you want to change? You ask your client those questions. Ask questions like, how does this make you feel? What would you like us to accomplish here? It is a good idea to encourage the client to set some goals. Avoid advice giving. We don't give advice. Like I said in the first, when we're just doing the introduction to counseling, like we don't give advice in counseling. You are merely to help the client arrive at the decision regarding the actions they should take. Avoid sounding judgmental in your approach. Listen attentively to your client. If the client is silent after you ask him or her the question, do not become impatient. Wait patiently until the client answers. Silence is very much okay when it comes to counseling. So for today, on the counseling process, we're going to end on the step number 3. In the next session, we'll continue with step number 4 on counseling process. Thank you very much.